Hello, my name is Jesse Ford, and I will be discussing the rise of Lyme disease in the United States. Lyme disease has significantly increased in the past few years. Lyme disease is contracted by being bitten by an infected tick. Early symptoms may consist of a bullseye rash, headaches, joint pain, and fever, but can also contribute to chronic muscle pain, facial dysplasia, irregular heartbeat, and nerve pain. It's primarily been concentrated in the northern east coast of the United States, but it's spreading at an alarming rate. Today, I will show data primarily focused on geographical location, and I'll finish with discussing other variables such as seasonal effects, age, and race. I'll also discuss how this data can be used to develop policies for specific demographics to deploy resources to heavily infected areas. So let's get started. We're going to look at the total number of cases between 2000 and 2018. You can see here that it's primarily focused in the northern east coast of the United States. But if you add a calculation that looks at the percent increase of total cases during that same time frame, you can see that it's rapidly spreading to adjacent locations and also moving westward. So now that we know where it kind of is, let's go ahead and break that down by region. We're going to look at these particular regions, and these are broken up consistent with how the CDC breaks them up. And we can see here that they all have an upward trend, but there's different types of trends that can be used to predict how many cases we could see in the future. For example, this is very, very noisy data. So our 95% confidence interval is going to be very, very high. But if we look down here, this is very, very not as noisy and as much, and you can see our 95% confidence interval is very much narrower. But the take-home message really is that all of these significantly infected areas are all increasing, while down here, it's pretty much non-existent. Now that we know what regions are being infected, let's go ahead and break it down, see if we can break it down by state. Now, we're going to look here just at the last 10 years, and we're going to, instead of looking at total cases, we're going to look at incident rates, which factor in population. So these are number of cases per 100,000 people. This is particularly important because now we can look at how each state is performing. Since states typically will have different policies and regulations, we can see which ones are the most effective when controlling for Lyme disease. For example, Rhode Island and Massachusetts are adjacent to one another, but they're experiencing different trends. Massachusetts here sees a significant decrease here, while Rhode Island has a significant increase here. Looking at this cluster diagram, we can see the bigger disparity in these particular trends. This can also allow us to ask certain questions. For example, Massachusetts, did they have a public service announcement around this time that was particularly effective? Or in Rhode Island, was there a housing development that happened, or did they open up a new hiking trail that involved this significant increase? Or is there some combination of the two? Are ticks migrating a particular area, or are deer migrating that carry the infected ticks? Even though they aren't adjacent, we can also look at other trends between states to again ask the question, why? So now that we know what regions are being affected, what states are being affected, now we can ask the question, when are people being affected? So in this, we can see that's a very obvious seasonal effect, where these 3 summer months are in the upper quartile and have the most total cases in the last 10 years. This is particularly important because now we can determine when policy changes can be more effective. For example, starting a public service announcement in the summer months would be way more effective. Also, we know when to deploy particular resources for healthcare workers, such as for treatment or for testing. Now that we know where people are being affected and when they're being affected, we need to know who is being affected the most in order to focus on those particular people. For example, I broke apart age groups for total cases, and we can see that our most vulnerable populations are being affected, the very, very young and then the very, very old. Also, we can break it down by race, and we can see that Caucasian population is most affected. And finally, we have a Pareto diagram that shows that 20% of these states determine or have 80% of the total number of cases, and we can focus on these particular states. So the take-home message today really is that East Coast is the epicenter of Lyme disease. It is a seasonal infection and is rapidly spreading across the United States. All these data sets were gathered by this Center of Disease Control Prevention in the Lyme Disease Data and Survey category. Thank you.